centers, which there are too many of them to me to list up and down our great county. Marlene, you have the floor.
Thank you very much. And nice to see everyone. I recognize some faces on the screen here. So hello to all of you, and especially to those I haven't seen for a while. It's great to see you. With me is Rocky Phillips, spinning it around here, trying to keep our social distance going here. She is our public health nurse with our public health services, and she does home visiting, coordinating a bunch of things, doing a lot of work right now, as you can guess, on COVID-19 and COVID-19 response. So again, thank you for inviting me. I thought I would give you a little bit of an overview of what we do and what is Tillamook County. It's actually community health centers now, previously family health centers, and affectionately known by many people over the years as the health department. See some little hearts. Feel free to give me the claps or do a little reading. So the community health centers are an integrated organization that has family practice medicine and public health kind of put together. We have a number of other services that are included in that integrated care, which includes medical, as mentioned, dental and behavioral health services. We just added a new psychiatrist to our team. Dr. Borman, who is not on the call today, is on both our community advisory group that advises the work of the health center, and he also is a volunteer surgeon, orthopedic surgeon with our clinic. We have a new dental clinic that is opening up here, and hopefully, I'm crossing my fingers because with everything going on, you never know, but hopefully here in a couple of months. We have around 60 to 65 people that work for this organization, from public health nurses like Rocky to medical doctors. We have 3 physicians right now who work with us. A new physician that just joined our team is Dr. Craig Brown, and I mention him because he started when the health center was originally formed right around 1994, between 1994 and 98. And now he's coming back. He says he missed the grassroots work of working with an organization that really tries to meet the needs of all people in our community, regardless of their ability to pay for services, and to really be adaptive to those needs in our community. I know everybody's particular concern right now about COVID-19, and the responsibility on the public health side of our services is responding to emergencies, and in this case, an emergency that relates to a disease or a communicable disease. And so today, I think the request was that I provide a little bit more information about what's going on with that. I have to apologize to Representative Gomber because he'll hear this report in the morning. He always hears those on Friday mornings, but I so appreciate your input on those calls. It really is an opportunity to be updated. So I wanted just to give you an overview of where we are right now with positive cases in Tillamook County, and a little bit about what's happened with the pandemic in Tillamook since March. Right now we have 52 positive cases. Those are broken out into presumptive cases and cases that are confirmed positive. And I know people ask questions about, well, what does that mean? So a positive case means they've actually tested positive for COVID-19. If it's presumptive, they are a close contact to a positive case and are exhibiting symptoms. And I have the public health nurse here to correct me if I get these things wrong. She knows these definitions really well. So in that instance, the numbers, I wrote them down so I could break them out for you. We have 46 confirmed positive cases and 6 presumptive. So those people may have a test in the coming days and then enter onto our list of what's called positive cases. So over the past, well, since March roughly, that's when we had our first case, we've slowly increased in the number of cases that are positive in Tillamook, but our numbers have been pretty low, lower than the state average for the the whole time.
Yeah.
And currently we have had a few over this one this week, 2 the last week, just kind of small numbers as they're growing. And we actually had a gap of a couple of weeks where we didn't have positive cases. But we've just continued to increase in cases over time. Often questions that we get asked is, so what is the cause for these? Not the root cause, but how does this spread occur? And is it because people are, congregating? Is it a workplace? What's going on? What we have found I think it's fair to say about 75% are really people getting together with family or friends, traveling other places to meet up with those folks, and they're spreading the disease that way. They come back and they bring that with them. So when we test people, we find out that, and ask them, and I'm going to have Rocky talk about what contact tracing is, but that's kind of how we find out what happens with some of those cases. In our county, we've tested 3,034 people to date. So we haven't tested as many as you might think, but that's a pretty good chunk for a community of around 26,000 people. We continue to test people on a weekly basis, a daily basis. What you need to know still is we have limited testing, so we only test people with symptoms. Well, why is that? That's another question we often get. The way that tests are made available in the state of Oregon is based on the population size, where the prevalence of disease is, and the high-risk populations or where there has been an outbreak. We're smaller, test amounts are portioned to us differently, and over the entire state and United States, there's a limited number of tests. So we're hoping here by the end of the month to receive what's called a rapid test, which means we can conduct tests and they'll be completed in 15 minutes. There's some that take up to 2 hours, but we're hoping that we would have that available to us. The amount of tests we can do on that are still small, but we can start testing people who may not have symptoms. That's our goal for people that are concerned about working in a community or in a workplace or in one of those high-risk settings, which include things like congregate care or healthcare workers, people who work in close contact with others in their workplace, like manufacturing facilities and the like. Also, we know that in Oregon and across the US, minority populations are disproportionately impacted by COVID-19. So we're making sure that we have access to tests for those populations. They've been prioritized in Oregon to ensure that tests are conducted. So what's going to happen next? I don't know. I wish I knew more about what's going to happen actually with the disease spread. You can see the modeling as well as I when you look at the information that's available through the Oregon Health Authority or with the CDC or other nationally recognized sites. I know we're preparing in Tillamook County to look at the next phase for schools because they all opened remote, and some are looking at what they're calling like a soft opening back up for some students and testing that. So we're preparing and working with schools about how to ensure it's safe for students and staff as they start to open back up. That may happen full in January, it may happen sooner, it may happen later. It kind of just depends on how things progress in Oregon through several criteria. Are we keeping our case rates low? Are we prepared for any kind of an outbreak, which means all of our hospitals are ready and have the equipment they need, we have the beds, and that people who provide the care have the equipment they need to be safe and to keep patients safe, like gowns and masks and face coverings for patients and gloves and hand sanitizer. As you all know, it's been a roller coaster ride with availability of some of those kinds of supplies. So right now we're okay with those for Tillamook County. We have not experienced any outbreaks, which you may have heard about in Lincoln County or in Clatsop County. So how it's defined by the state means there's a workplace of 30 people or more with 5 people that have tested positive. We haven't had that in our community, fortunately, and people have been very proactive in making sure that staff are safe. Luckily, we also haven't had any deaths as a result of COVID-19 to date. So that's a blessing. Let me look here and see. Age ranges. People often ask about age ranges. Initially, the people that were being tested were people that were over 50 years old, and the disease, the consequences of the disease for people that fall in that age group or people who have other risk factors, that kind of makes sense. We're testing people who are sick and trying to make sure that they don't get really sick because it's life-threatening disease. Now you'll see kind of an age spread with number of people getting tested. There's still a bigger chunk of the population that falls in the positive tests of 50 plus.
Of people that are tested, yeah.
Yeah, of people that are tested, yes.
In Tillamook County, though, we're
Let me
still...
spin this over. Rocky is speaking.
You don't need to spin. I can just talk loud. So in Tillamook County, the majority of our cases are still in the older population, but we have seen our first pediatric case, and we are getting a few cases here and there in that under 30 range. We had a few of those, but the majority of our cases in Tillamook County would fall in that over 50 category.
So I'm going to switch a little bit to, if there is a positive case, people sometimes ask about, well, what does contact tracing, why is it important? What does it mean to me? And Rocky is part of our team that does the investigation for those cases. So I'm going to let her talk about what is contact tracing, what happens, what's a close contact, those kinds of things. Are you ready? I'm going to spin it to you now. There you go.
Okay. So contact tracing can seem like a really invasive thing for people, and I understand that. But the big reason why we do contact tracing and case investigation is to help slow the spread of the disease. And that's the whole reason why we really do it. And then out of that, we also get some important information like demographics. And through contact tracing and case investigation, that's really how, you know, we can definitively point a finger and say that, or point a finger might be the wrong term, but we can definitively say that, you know, certain minority groups are disproportionately affected. So we learn So we learn other really important things like that through contact investigations because we gather some of that demographic data. But when it comes right down to it, what we're looking to do is find out when somebody first developed symptoms, when did they first get sick? And we're trying to, based on the information we know about this particular disease, we're looking at when could they have been infectious, and we're trying to find anybody that they had close contact with during that time. And those would be the close contacts. So a close contact is defined as anybody who spent more than 15 minutes with somebody less than 6 feet apart. And that's the strictest definition of a close contact for COVID-19. And when we're doing contact investigations, we are looking for, when we talk to the person who tested positive, we're asking them, when did they first develop symptoms? And so then based on that, we're developing a timeline, and we're going through that timeline with that person on a day-by-day basis to try and identify anybody that met that criteria of a close contact. If somebody was asymptomatic and tested positive, well, we've had a few of those. So like, you know, maybe somebody who went in for a procedure and they had to get COVID testing before they could have their procedure done. So we have had a few cases like that where they tested positive and they didn't have symptoms. And so in that case, we can't really look at symptoms to determine that timeline. Then we look at when did they get tested, and we go 2 days before that. And then that establishes our timeline for when we're looking for positive cases. And then once we get all the contact information and anybody that they're identifying as a close contact, then we start making phone calls, and we start calling anybody who's been identified and informing them of their risk. And Marlene had mentioned earlier about isolation and quarantine, and that's where this comes into play. So anybody who tests positive during their infectious period is asked to quarantine or self-isolate. Sorry, I do it backwards too. Anybody who's test positive, they are asked to self-isolate for 10 days because studies have shown that 10 days is the infectious range of an infectious period. And if so typically we go from symptoms onset, but if they don't have symptoms, then we use the day that they tested positive. And so they're asked to self-isolate from anybody that is around them for 10 days. And then, but their contacts are asked to self-quarantine for 14 days. And the reason why it's 14 days and not 10 days, which seems like a really long time, especially when you're not at work or you're missing work or childcare is an issue, all that kind of stuff, is because it can take anywhere from 2 to 14 days for somebody to start developing symptoms. And so then the next question we get is, well, why don't we just test people? Well, that's why, because it takes 2 to 14 days for your body to develop, or it could. So once you're exposed to the virus, it could take 10 to 14 days for your body to grow enough of that virus to be detectable on a test. So theoretically, we could test a close contact on day 2 and they'd be negative, and then we turn around and test them again on day 8 or day 10 and they become positive. So when we're looking at trying to utilize our available tests to the best of our ability, that's one place where we do that. We don't test people who are close contacts unless they're symptomatic. And then even then, sometimes they are not tested. If they have the right symptoms, then they're converted to a presumptive case. And there's a specific list of symptoms that somebody has to have to be considered a presumptive case. But if somebody develops symptoms that are kind of ambiguous and not quite fitting that definition, that would definitely be a point where we would say, let's test you and see what's happening. So that's the positive and presumptive, and then investigation. One of the questions we get, Tillamook County is a small community. It's a very small community. And so we get a lot of phone calls. We have this wonderful phone line, currently calling it the COVID nurse line, where community members can, and it's been advertised, and the number is 842-3940. And this number has been put out and it's been advertised. It's on our website, where community members can call public health and reach a public health nurse directly. So like me or Sarisa or Christy or Morgan, those are some of our other public health nurses in Tillamook County. And they can talk to one of us directly and ask us questions that they might have about COVID. We love talking to people and being able to just answer people's questions directly. It's really kind of been a part of all of this, is being able to talk to our community partners and members and get to know people on a one-on-one basis. But one of the things that we get lots of phone calls about is when we do get a positive case in Tillamook County and that person then puts it out on social media and it becomes kind of public knowledge at that point. We cannot ourselves confirm or deny any positive cases. People often ask us, what part of the county are they in? What's their zip code? Is it North, Central, South County? We're like, oh, I'm sorry, I can't give you that information. What I can tell you is what we would do in the event we get a positive case. And then we go through the whole explanation of what happens. Because frequently when somebody tests positive and it becomes known on social media or something like that, because they post something, then everybody that they have known or been around for the last month is like, oh no. So we get a lot of phone calls like that. And so we spend a lot of time reassuring people. And we can't call anybody and say they're a contact unless the person who tested positive actually identifies that person as a contact. So in some cases, our ability to investigate or identify contacts is limited to the ability of the individual who tested positive to be a good historian. So that is a limitation there. But we're always happy to take phone calls and answer questions. What am I forgetting? So we talked about contacts and isolation versus quarantine. Marlene, am I forgetting anything?
No. What should someone do if they think that they're a close contact to someone who's positive?
They can call us and talk to us about it.
Okay, that's what you were just saying. I
Yep.
just wanted to make sure.
So if
Okay.
somebody has questions about being a close contact, they can call that COVID nurse line and they can talk to one of us directly. And we can't confirm or deny any positive cases, but what we can do and what we always do is we walk that person through a scenario. If somebody tested positive, this is what we do. This is what makes somebody a close contact. And we might ask that person questions and help them kind of get some more information and help them and reassure them in that way.
Recently, there's been some questions, and then I'll leave it so you guys can ask questions about, well, what about people who travel outside of the United States? Or I heard that someone went to an area of the country of the United States where there's more prevalence of positive cases than there are here. Right now, the guidance for pretty much anywhere, I think other than like Mongolia, outside of the US is a risk area. So we encourage people to continue to use the precautions that you've all heard about so much, about wearing a face covering, washing your hands, social distancing, and the like. While people are on vacation, do that also. If you're traveling back, consider getting a test in a community that has tests like Washington County for people that don't have symptoms. If you are concerned or you start to experience any cold or flu-like symptoms, you may have to go back for another test, as Rocky indicated, because the time frame may fall such that you have a longer period of time that you could have contracted disease, or there could be a lapse in time. Also, for people who are traveling within the US, if you're concerned, you can also check if you have symptoms, call the nurse line, call your provider about your symptoms or your concerns again, or call the nurse line and they can walk you through what your steps might be. And I know that there's more frequently asked questions on our webpage and our Facebook page. We're going to kind of open it up for people if you have questions about the health center or about COVID-19, and we're happy to answer them.
All right, so I have the first question. It was because she raised her hand before anybody else did.
Hi, we live in Cloverdale. There are no community health services in all of South County that I'm aware of. And there's also no pharmacy here. Every time someone needs a prescription, they have to travel at least a half an hour by car. The bus is very infrequent. We have a high prevalence of opiate and meth use here in South County. And I'm just wondering, when I heard the county got a grant to be doing some services, if that happens, if you've developed a program yet, if you're going to have programs in the community here so that people can actually access the services.
Mm-hmm. So we have a mobile clinic that we recently acquired, which has been co-opted in many ways to respond to COVID-19 and other types of screenings. So we can have the mobile clinic available for both North and South County. A priority in talking with the schools is to make sure we have that clinic available for schools in South County, but it would be open to the community. That was going to take a little longer to do given our current circumstances. Your second question about opioid use disorder, substance use disorders. We at the Community Health Center have recently started a medication-assisted treatment program for people who are addicted to opioids. We have, at any given time, we have about 40 people who are enrolled in the program. We are making that service available throughout the county. If there are barriers for people, because you have to drive, if you have a vehicle and it's a barrier because of cost of gas, we can pay for vouchers for people to travel. If they're not supposed to travel because of some kind of a criminal history or a record, we can work with people to get transport available to them. Part of delivering services throughout the community for treatment for behavioral health includes traveling to South County. And we have, now we have 2 behavioral health clinicians. We're hiring a 3rd, and we have a psychiatrist to deal with medication management and prescribing for that population. All in order to provide treatment for people who are addicted, our medical doctors have to have a certain waiver to prescribe medications that are considered opiates or fall in that category of scheduled substances. All of our providers do. I think we have 5 that have received their waivers. I have to think about that. Psychiatrist, MD, PA, 5 that I know for sure. So that's where we are right now with those services. If people have questions, they can call the clinic about how to access them. We partner with Tillamook Family Counseling Center also, and we'll keep people updated on when we start to provide more services in South County satellite with our mobile clinic.
And do you link up with the jails? I mean, we see people that are in and out of jail and they have kids living at the home. Yeah.
Yeah, we do, and we work with the correctional facilities if there are people that are interested in enrolling in that program. Thank you for your questions.
So that next question is Kathy Blevins.
Yes, thank you. I was unfortunate enough to spend some time in the hospital in Tillamook, and I was shocked that when I was admitted, I was given a COVID test, and I asked the people that were taking care of me, the nurses and CNAs, how often they were given tests, and they said we are not tested unless we are showing symptoms. And is that again because of the lack of tests?
Yeah, I would say the primary reason for that is, test availability management. But people who work in the healthcare field are potentially exposed to a wide variety of infectious diseases on a daily basis. So if to do regular testing, it's something that you'd almost have to do on a daily basis, which doesn't, from a practical sense, make much sense to do. And everybody should be following, I mean, I don't work for Adventists, but anybody in a healthcare setting should be following all standard precautions for infectious disease transmission, depending on the types of services that they are providing, whether that might be a full gown and mask and gloves, or if it's just, depending on the types of services that they're providing is going to determine what type of PPE or personal protective equipment that people need to don. So that's kind of the short of it. Does that make sense? Yeah, I know it's not a perfect answer, but it's a lot right now. Yeah.
Next question, and I see Andrea's got her hand raised, but I'm going to go to David McCall first.
Yeah, thank you. Marlene, I just wanted to ask, because I think later in the agenda, the group will be discussing different ballot initiatives, and one of them is Measure 108, which is about raising the cigarette tax and imposing a vaping tax. My understanding is that your office, meaning big office, has been exploring or looking at a tobacco licensing requirement for the county, and I wanted to know, first, are the two related to each other? And second, would you like to speak to that or bring that up in the vast amount of time you have?
Yes and yes. So we, through our public health and our tobacco prevention education coordinator and state Oregon Health Authority staff, we're working on a tobacco retail licensure ordinance for Tillamook County. This is to address the concerns about young people starting vaping, but also just having those products available for anyone in our community. The monitoring how that information is available, and the product is available to individuals The draft ordinance that we have is based on the one that's used in Clatsop County or has been implemented in Clatsop County. Right now, we're in the process of talking to cities to get their thoughts on an ordinance. And we have talked to retailers about an ordinance. For us, it's a fee that a licensed facility would pay per year of around $300, which allows us to do some monitoring, responding to complaints, signage, ensuring that people are complying with the rules to limit products to young people. The state ordinance is definitely related to the same effort. You'll see an overlap. Right now, in general, response is pretty positive, but timing is not so good. So you can still enact an ordinance with a good intent and a belief in what it stands for and postpone the implementation of the fee for those businesses that are really struggling given COVID-19, if that does impact their revenue for super small businesses.
Thank you for that. So we have just about 3 minutes left for questions. So I have Andrea and then I have Logan. Andrea, you're first.
So, hi, Marlene.
Hi.
Are you giving flu shots, and when do you recommend we get flu shots?
We are giving flu shots. Now is the time to get flu shots. So between now and October, although they're available throughout the flu season, all the way into February for people, we are starting to schedule our clinics. You'll see them posted. As you know, you can receive flu shots at some pharmacies. You can go to other communities and receive them. If you received a flu shot earlier, you may need to have a second one to ensure that you're covered during the whole flu season. So check in with your provider about that. Or there's also dosages of flu shots, extra strength.
Oh, so for people of a certain age.
Let me spin that back over to Rocky.
I don't have the protocols in front of me, but people of a certain age, they can get a high dose flu vaccine, which provides you with additional coverage against the flu. And we do recommend that people get the flu shot this year. As always, we recommend it every year, but this year is even kind of more important with COVID, and because the symptoms are so similar, even though they affect us in a little bit different ways. And then our schedule for the flu clinics that are going to be occurring throughout the county in North, South, and Central County are being finalized right now and should be published here in the next week. I think the first week of October is when we start those flu clinics, where anybody can come in for a flu shot or go to whatever location that we're doing them at. So that schedule will be forthcoming very soon.
Thank you.
Thank you.
So I have Logan. Logan, if you have a quick question, we really have to move on to the next part. And I'm wondering if, and I don't know, we've got kind of a packed agenda, if there's going to be time later for questions toward the end of the meeting, if Marlene and Rocky, you might be able to stick around with us for a while.
How long's your meeting?
They usually last about 2 hours.
You got kids at home.
It's
Okay, I totally understand. So Logan, why don't you go ahead with a quick one and we'll get to our next. Yes.
You know what? I'm going to postpone my question and ask you a quickie. What is the best way that if we have any more questions, what is the best way that we can get in touch with y'all? I guess about anything really, not just public health or just clinics, but like these nice policy or how to present services. Like, who do we contact and how?
Mm-hmm. Well, you can reach Rocky if you call the COVID line, and it's basically our public health nurse not line, which we'll just keep listing as our public health line, which is 842-3940. If you want to reach me, my number is listed with the county directory, and my direct line is 503-842-3922. Also, you can email me, that's also listed. All of the county addresses have the same pretty much tagline on them. Mine's M Putman, and then it follows at co.tillamook.or.us. We do have a web page that has a contact link, Facebook page if you want a messenger on there. We don't have Instagram or Twitter right now.
All right, thank you. Just go ahead and look at the chat and make sure that looks right. Thank you.
Thank you. If you have questions from this meeting that you want to channel through somebody, you can pick someone here and we can try to respond to the list if you want.
I want to thank you on behalf of Tilco Dems. One, for being your whole staff is on the front lines, and we really appreciate that. And thank you for the time that you spent with us in a very busy time and very busy schedule. This has been very informing, and we will post some of your connection numbers maybe on our webpage if our communication partners will agree. And we also are recording this meeting, and so that will be available to people at a later date, and we appreciate that. So thank you. Thank you.
Thank you very much.
Thank you.